Hello and welcome to Medical Coding Basics 101. My name is Sherry Bronner. I'm the HIM Director here at Addison Group. We'll go ahead and begin, and I will answer questions at the end of these slides. Thank you. What is medical coding? Medical coding is a translation of medical documented patient encounters from written notes to numeric and alphanumeric codes. It's basically telling a story using medical codes, what condition the patient has, and what was done to the patient to treat this condition. The condition a patient has is considered a patient's diagnosis, ICD-10-CM. What is done to treat the patient's condition is the procedure, CPT or ICD-10-PCS. Once these codes are translated from the coders, they are submitted to insurance companies for payment. These codes are submitted by any healthcare professional or healthcare facilities for payment of services and supplies provided to patients. These codes are submitted on healthcare claim forms to insurance companies for payment. One diagnosis must be on all claims for inpatient and outpatient. For outpatient, there must be at least one diagnosis code and one procedure code. What is a coder and what are their responsibilities? Coders are highly sought after and highly skilled professionals who work with providers of healthcare or healthcare facilities as translators of medical documentation to medical codes used for reporting and reimbursement. Coders are responsible to make sure that the documentation in the medical record is consistent with the coding assignment placed by them and follows the official coding guidelines set by the coders, code books, and controlling regulating agencies. Coders must only code documented diagnoses and procedures. The golden rule for coders is if the service is performed and it's not documented, the services was not done. Therefore, it has to be stated within the medical record. Coders are also responsible for checking to make sure the encounter was medically necessary. Medical necessity is a reason for the visit or a purpose of the encounter. This is normally proven through a diagnosis code. Slide number 4. What do you need to be a coder? There's two main associations that provide the certifications. It's AHIMA and AAPC. To be a certified coder, you have to be credentialed through a certified agency. Most organizations require that their coders are certified. The two major certifying agencies are AHIMA and AAPC. Most hospitals across the country prefer AHIMA, as they believe that this is more hospital-based credential and have superior coders. AAPC is thought to be more of a prophy or physician-based credential. You must also maintain your coding credentials by paying yearly dues and getting CEU, continued education units. A lot of coding companies pay for these for their coders so that they will ask if this is something offered. Basically, Addison, the great news is Addison does provide quarterly webinars which will, each coder will receive the CEU, continued education units. Slide number 5. What are the different what's the different coding credentials? With AHIMA, there's RHIA, there's RHIT, CCS, CCSP, CDIP. The RHIA, you will need a 4-year degree, which is qualifying you for the credential. Most hospitals want coders that are going to be considered for management to have this credential. Some RHIAs work regular coding positions as well. RHIT, Registered Health Information Technologist. You need 2 years of a college education to qualify for this credential, and most work coding positions, and some accept this credential for management roles. CCS, Certified Coding Specialist. This credential is what most hospitals look for regarding inpatient coders and outpatient coders. This means that this coder has a mastery knowledge of coding. CCSP, Certified Coding Specialist, Physician-Based. This is a HEMA physician-based credential, and most hospitals will not accept a coder with this credential. They will, well, let me back up there. This slide's kind of reading off here, but the CCSP is basically one of the mastery skills when it comes to physician-based coding. As it says further in that paragraph, for a mastery level knowledge in coding physician or pro fee services. CDIP, Clinical Documentation Improvement Practitioner, is a credential that is recognized as being a practitioner in documentation improvement. These CDIPs work with hospitals to improve documentation for hospital services to improve compliance. Slide number 6. What are the different coding credentials? Continued. Now we're talking about AAPC. CPC certification, it's Certified Professional Coder. Some hospitals will recognize this credential as a great outpatient certification, but this credential is mostly, like I just stated, mostly full geared towards physician-based coders. COC, Certified Outpatient Coder, validates proficiency in the correct application of CPT, HCPCS Level 2 procedure, and supply codes, and ICD-10 diagnosis codes used for coding and billing in an outpatient hospital setting. CIC, Certified Inpatient Coder, validates proficiency in the correct application of diagnosis codes used for coding and billing for medical claims in an inpatient hospital or facility. CPCP, which is a Certified Professional Coder Payer, validates proficiency in the correct application of CPT, HCPCS Level 2 procedure and supply codes, and ICD-10 diagnosis CM codes used for coding and billing in a payer environment. CRC, Certified Risk Adjustment Coder, validates proficiency in the correct application of ICD-10 CM diagnosis codes used for risk adjustment payment model. Slide number 7. ICD-10 CM International Classification of Disease 10th Revision Clinical Modification. ICD-10 PCS International Classification of Disease 10th Revision Procedure Classification System, PCS. CPT, Current Procedure Terminology, Outpatient Coding. HCPCS, Healthcare Common Procedure Coding System. APCs, Ambulatory Payment Classification System. DRGs, Diagnosis-Related Groups. Slide 8. What are HCPCS codes? Healthcare Common Procedure Coding System. Procedures, DMEs, supplies. If you want to kind of read through this, HCPCS Level 2 is a standardized coding system that is used primarily to identify products, supplies, and services not included in the CPT codes. Slide number 9. What are CPT codes? CPT code sets are 00000 through 99999. The current procedural terminology, CPT, code set is maintained by the American Medical Association through the CPT editorial panel. The CPT code set accurately describes medical, surgical, and diagnostic services and is defined to communicate uniform information about medical services and procedures among physicians, coders, patients, accreditation organizations, and payers for administrative, financial, and analytical purposes. The current version is the CPT 2016, which now, as of 11/10/2016, they have actually came out with the 2017 books, but they will not be effective until January 1 of 2017. Slide number 10. What is ICD-10 CM PCS? ICD-10 PCS codes are the International Classification of Disease 10th Revision Procedure Coding System. It is used, it's a system that is medical classification used for procedure codes that track various health interventions taken by medical professionals. ICD-10 PCS codes are required for all inpatient accounts for any procedures performed. Most clients do not require ICD-10 PCS codes for outpatient procedures, as this does not affect reimbursement. Below are a few reasons the clients may require the coder to actually code PCS codes. To be, this is a requirement from some clients. It is not for all. It does look like they are gearing towards making this a requirement in the future. Again, it does not affect reimbursement. It's the three reasons below. Their state may require this information. The payer contract requires this data. The internal quality program leverages the ICD-10 CM PCS codes to group inpatient and outpatient procedure for reporting or tracking purposes. So it's just basically for reporting. Slide number 11. What are DRGs? DRGs is diagnostic related groups, are classification systems that are used by hospitals only to receive payments for services and resource that the hospital supply to the patients that are considered to be an inpatient account. DRG grouped by hospitals grouping software based on ICD-10, CM, and PCS codes that are assigned to a patient's encounter after the coder has read and coded the record. What are the types of coding that the coders perform? Facility coding, hospital coding. Inpatient coding. Great inpatient coders are rare and highly desired. These are the different areas in which they may have coded and may have experience. OBGYN, cardiac procedure, newborn, medical procedures, transplants, high-dose chemotherapy, surgical. Next, it is outpatient coding, emergency department, ancillary, same-day surgery, and observation. Slide number 13. What do the coders use to code? Coders' official coding books manuals is one. Some companies do provide this. Addison does not provide this currently for any contract or contract to hire. Coders that we bring on board, as each coder should have access to the client's encoder software. Coders code using ICD-10 CM PCS International Classification of Disease 10th Revision Clinical Modification Procedure Coding System. CPT books, current procedure terminology, HCPCS books, healthcare procedural common sets. In October 1, 2015, coders will code ICD-10 CM, but we know we're well past that now, right? We leave this in here just to keep you informed that as of 10/1/2015, ICD-9 code changed to ICD-10, which was a very major change. Also, just to note, while we are discussing the changes, as of 10/1/2016, there was a lot of changes for ICD-10. That would be a really good question, and I would strongly recommend asking this during your interview. How was you trained for the updates that occurred October 1 of 2016? The next, one of the next resources that coders use encoders. There's the types of encoders that you see a lot of. When you talk with coders during interviews, you'll probably hear they have experience with a 3M encoder. Also, there's Encoder Pro, TrueCode, Quantum, WebStract. Slide number 14. What are the types of coding coders perform? We have physician coding, professional fee coding, E&M level, surgery, office visits, multiple physician specialties coding. For an example, oncology, nephrology, general surgery. We have HCC, hierarchical condition categories, payment for Medicare Advantage insurance companies, capitation. Slide number 15. What healthcare HIM positions does Addison recruit for? As it lists below, we recruit for inpatient, outpatient, pro-fee, physician coders, facility auditors, physician auditors, CDIP, clinical documentation improvement specialists, and then also within the scope of the outpatient, there may be a specialty type of outpatient that they're seeking, interventional radiology, rehab, physical therapy. These are type of codings that they strongly would probably recommend lots of years of experience to bring on someone. For an example, interventional radiology is very complex. You really need to know your medical terminology for that. So just always know that I'm available and also the coding manager for Addison. If you ever run into questions about if you feel that a potential candidate is a fit for a particular position, please always reach out to us. Slide number 16. What is inpatient? A patient is considered inpatient when the patient is admitted to the hospital with a doctor's order. The day before you're discharged is your last inpatient day. There must be an admission order in the medical record in order for a patient to be considered inpatient. This is a good recruiting question. Good recruiting question could be, what must be listed in a medical record for a patient to be considered inpatient? As it read above, they need an inpatient order by the physician. Slide number 17. What do inpatient coders do? Inpatient coders read and translate medical encounter for inpatient stays from written description to medical codes. Inpatient coders code using ICD-10, CM, and PCS only. You will not find a CPT requirement for inpatient coders. With saying that, I have came across in the past for reporting bases that some, very, very rarely, you would hear of this, would like you to report CPT codes when you code the PCS procedure codes for inpatient. But that is very, very, very rare. And it, again, it's just for reporting purposes. In ICD-10 CM, there are special inpatient diagnosis guidelines that must, each inpatient coder must follow, as well as an outpatient coder. You have specific coding guidelines for them as well. They utilize ICD-10 CM for their diagnosis code selection and PCS for the procedure code selection for inpatient encounters or inpatient coders. There's an example below. Please read and let me know if you have questions. Slide number 18. What inpatient coders do continued. Inpatient coders code common inpatient encounters. Below are the most common types of inpatient cases a coder should know, basically know how to code. Good recruiting question, every inpatient coder knows the answer. So basically, it's really key when you're doing an interview for these coders that you let them tell you their experience. Don't lead them into saying, hey, do you have acute kidney failure experience? Let them tell you, let them do most of the talking. And again, after they're done explaining what their experience is, then you can kind of dig in and see, if there's a specific skill set that the client wants. You can, definitely go into that still with them and ask them specifically. But I always let them talk first and let them explain their experience. Slide number 19. What inpatient coders do continued. Inpatient coders are also responsible for making sure the record is complete and accurate. Coders are responsible for assigning consistent diagnosis listed throughout the record. Coders are responsible for assigning a POA, present on admission, indicators attached to the code assignment. If there are any inconsistent or ambiguous documentation, the coder is responsible for querying the appropriate physician to clarify the documentation. So, say for an example, that there was a diagnosis listed throughout the chart just once. One time you see this diagnosis, and you don't see any treatment. At that point, that coder might think, does this warrant a query for clarification to make sure that they can actually list that diagnosis code when they submit these for reimbursement. Slide number 20, what is a query? Written request from a coder to a physician to clarify incomplete documentation in the record. Queries become a part of the permanent medical record. Coders' queries must not be leading, which means they cannot lead a physician to a particular code or documentation assignment. Slide number 21. How are facilities reimbursed for inpatient encounters, and how do coders affect the reimbursement? Inpatient coders are a critical part of the hospital's reimbursement. They assign the ICD-10 CM diagnosis codes and the ICD-10 PCS procedure codes that map out the DRG, which is submitted to the insurance companies for payment. If the coder incorrectly assigns the ICD-10 code, the payment will be incorrect, which will impact the hospital's risk level financially, potentially. As you can see, the right-hand lower corner there, that gives you an example. It shows what the DRG assignment is. It shows the diagnosis codes and the procedure codes. So that's kind of an example, like a snapshot of what 3M Encoder may look like once the coding is completed and submitted. Slide number 22, what are key elements for inpatient coding? Facilities want to ensure that the correct code assignment is placed on the record. Facilities want the coder to use additional resources to ensure proper code assignments such as AHA, American Hospital Association, Coding Clinic, Fay Brown, Merck Manual, and official code books. Facilities want to make sure that the coders know when to launch queries. It's very important. If they don't know when to launch the queries, there might be missed opportunity for reimbursement. Facilities want coders to have the knowledge based to, when appropriate, optimize the DRG, which means, for an example, when two diagnoses meet the definition of a principal diagnosis, which a principal diagnosis is key on reimbursement. The coder is skilled enough to sequence the diagnosis with a higher DRG weight for more of a payment. Slide number 23. What is CDI, Clinical Documentation Improvement? The purpose of a CDI program is to initiate concurrent and, as appropriate, retrospective reviews of inpatient health records for conflicting, incomplete, or nonspecific provider documentation. These reviews usually occur on the patient care units or can be conducted remotely via the electronic health records. The goal of these reviews are to identify clinical indicators to ensure that the diagnosis and procedures are supported by ICD-10 CM codes. The method of clarification used by the CDI professional is often written queries in a health record. Verbal and electronic communications are also methods used to make contact with the physicians and other providers. These affect results and improvement in documentation, coding, reimbursement, and severity of illness, and also a risk of mortality. Slide number 24. What is outpatient? Outpatient is considered services provided in a healthcare facility that treat patients but does not require intensive monitoring or care and can be provided without an admission. And listed below, there's ER visits, observation services, and I want to speak on observation services for a minute. Although the patient gets admitted to observation, this is not considered inpatient. This is considered to be a setup from the ER, and the patient needs additional observation for monitoring, but it is not expected that the patient will be discharged home if things improved or if they do not improve. So basically, it's to monitor this patient to see, is the patient well enough to send home? Do we need to admit the patient? So that's kind of like when the doctors aren't certain and they do additional testing and things like that. Ancillary services is an outpatient type for an account. Outpatient surgeries, for an example, colonoscopies, breast biopsies, cardiac caths. Slide number 25, I'll let you read through that. It does go over the outpatient coding guidelines, which again, there is a difference. There is two sets of guidelines, one for inpatient and then one for outpatient. Slide number 26, what are the responsibilities for an outpatient coder? Outpatient coders read and translate medical documentation for outpatient encounters from written descriptions to medical codes. Outpatient coders use the ICD-10 CM, CPT, and HCPCS. For facilities coding, some hospitals require that coders to also report the CPT codes for ICD-10 PCS codes. On the outpatient basis, ICD-10 PCS codes have no value for payment and are commonly used strictly for tracking purposes. I wanted to point out on the slide that you will hear PCS is very rarely used for outpatient, but it is required for inpatient. Keep in mind, too, that if a coder can code inpatient PCS, and they're well-versed, they are a really good coder when coding these procedures, then they should be fine coding the PCS codes for outpatient. They are the same. There's no difference in the PCS codes for inpatient and outpatient. In ICD-10 CM, there are special outpatient diagnosis guidelines that must be used by coders. These guidelines are different from inpatient guidelines, and each guideline should be used in the appropriate setting. Slide number 27, outpatient coders' responsibilities continued. Outpatient coders use ICD-10 CM for reporting diagnosis and CPT for reporting procedures, and may use HCPCS for additional procedures, medical supplies, and medication. Slide number 28, outpatient coders' responsibility continued. Outpatient coders are also responsible for assuring modifiers when needed. Basically, they need to assign the modifiers when needed. They are appended to the CPT codes to clear edits. There are several types of edits a skilled outpatient coder should be aware of, such as LCD, local coverage, determinations, and NCCI National Code Correct initiatives. Slide number 29, what is a modifier? Modifiers are two-digit numeric or alphanumeric codes that are placed at the end of a CPT or HCPCS code. CPT modifiers begin with a number, and HCPCS National Level 2 modifiers begin with a letter. They are like adjectives, and they further describe the patient encounter to the payer. Some are for just informational, and others, may affect the reimbursement. So they are very important. It is necessary to know how to use these correctly to prevent denials. If you do not put a modifier on a CPT HCPCS code, that is required. That claim may be rejected and sent back to you. So we definitely don't want to have any denials. So these outpatient coders really need to know when to apply those modifiers. Slide number 30 is an example. I'll let you guys read through that. If you have questions, let me know. Slide number 31, what is LCD edit? If you want to kind of read through that too, it's local coverage determination. It's a certain type of edit. And again, edits mean that these claims weren't clean, that they will be sent back, and they are being questioned about being paid for. So we definitely want to look at those, make the corrections, and resubmit those claims for payment. Slide number 32, NCCI edits. You can read through this one as well. National Code Correct Initiative. Again, it's edits. These are claims that's being returned. The coder needs to figure out what they didn't add on there, or what is missing, or if they've added two procedures that shouldn't have been listed together. It is basically, these edits reflect like coding guidelines and required modifiers and things of that sort, and if the appropriate information is not on there, they may be returned, and again, payment may be denied. Slide number 33, what are the responsibility of pro fee coders? Expertise in reviewing and assigning accurate medical codes for diagnosis, procedures, and services performed by physicians and other qualified healthcare providers in the office or facility setting. Efficiency across the wide range of services, include evaluation and management, anesthesia, surgery, radiology, pathology, and medicine. A sound knowledge of medical coding guidelines and regulations, including compliance and reimbursement, is required. Understand how to integrate medical coding and payment policy changes into a practice's reimbursement processes. Physicians are paid fee for service. Slide number 34. What is medical auditing, and what do medical auditors do? Medical auditing entails conducting internal and external reviews for coding accuracy, policies, and procedures to ensure that you are running an efficient and hopefully liability-free operation. There are many reasons to perform a medical audit, and I'll let you guys read through that, but basically auditors are supposed to be the more experienced coding auditors that have many years experience, and basically they're educators. They review the coders' final coding scenarios, the submissions and things, and they make recommendations. Just to name a few here. There are many reasons to perform medical audits. Well, to determine outliers before large payers find them, and in the claim software and request an internal audit to be done. Having an audit done will protect you against fraud, claims that are being billed, and you definitely don't want to be in the spotlight for this one. So definitely audits are very key and very important to stay compliant. Slide number 35, what do facility auditors do? DRG Validation Auditor. Validation auditors validate the correct DRG assignment on inpatient claims to make sure that the hospital is receiving the correct payment. Compliance auditors are auditors that focus on the entire medical record for compliance, such as documentation improvement, misdiagnoses, incorrect abstracting, incorrect POA assignments, just basically looking at how, to make sure the claim's going to be paid. Slide number 36. What do pro-fee auditors, physicians, educators do? Well, basically analyze services performed by the physicians to ensure documentation supports services submitted for payment, and provides education to the physicians for miscoding and documentation opportunities. Slide number 37. This just gives you an overview, and I left these on here just because I wanted to let you know of the changes that was made as of 10/1/2015. This gives you some examples of what has changed. Like, for an example, if you look at the bottom there in the box, it has ICD-10 code sets to the right side, and it has ICD-9 CM to the left. You can tell that it really changed a lot. The ICD-10 codes are way more specific, and it does, which is the great news about that, is that it's more likely there won't be denials because the codes are so specific. If you look at slide number 38, it shows you how the changes occurred, like for a PCS code, procedure code. You can see, like, for an example, there was 3 codes listed here for this procedure, and to the right, as of the effective 10/1/2015, the ICD-10 PCS code, it only takes 1 code, but again, it's a very detailed code, and it has 7 digits versus using 3 different codes. The last slide, on slide 39, gives you some resources and references. I highly recommend that you take the time to maybe visit these websites and just get familiar with different things. And as you go through reviewing these websites, please let me know if you have any questions. I'm happy to, answer questions or show you how to even go in and use these websites. But this concludes the Coding One-on-One training. So if you have any questions, again, at this time, this is where we're going to stop, and we can go back to different slides if you want to revisit, or if you need additional information on anything that we provided within this PowerPoint. Thank you for your time, and have a great day.